Welcome to the Too Curious MD podcast. I'm Dr. Alya Ahmad.
And I'm Dr. Alya Ahmad.
In this podcast, we are asking the unasked questions.
We're physicians applying the lens of narrative medicine, exploring integrative practices and psychedelic treatment in health.
Together with our guests, we weave new learnings from stories, expertise, and the sciences. With the wisdom from holistic, alternative, and these conventional medicine, we are here to challenge the status quo.
We're curious about the connectivity and complexity between diverse fields of knowledge as they relate to consciousness, chronic illness, mental health, resilience, and beyond.
Learning more about the art and science of healing, or listening to stories of extraordinary healing. You're in the right place. Let's dive in.
This is the first recording,
11/2/2024. Yeah, we are doing it. We are talking to ourselves, each other, and really coming together from our stories, our lives, our experiences, our inspiration, and happy to be here with you.
yeah, same here. Very happy to be here. We've been dreaming about this. We've been contemplating.
Yeah,
We've been designing. We've been co-creating.
creating.
And this partnership feels like it needed to be brought out into the world. And it is being offered into the world with this spirit
Yeah,
of making something new.
yeah, and quirky. It has to be quirky and nerdy. It has to be.
We're all of those things.
Yeah, yeah, yeah.
Everything that we are
Yeah.
arrives here. So the podcast is
Who are
called.
you, Simi?
Oh my
Come
God.
on, tell me. Who are you?
We're both physicians.
Yeah, that's for sure. Went to medical school. That's an MD, medical school.
Medical doctor.
It's it's a label.
Yeah. It's one of the layers of our identities.
One.
And we're also mothers.
Oh, I love. I love the love that comes from being a lover of mothers. That came out. I don't know where it came from, but it came out from the vision of a mother and the lover of mothers, and that connection that motherhood brings.
Absolutely. We're pediatricians.
Pediatricians,
So we have been alongside mothers
all
our
the way,
entire careers.
seen it, heard it, felt it.
Yeah.
Yeah, the mother's eyes. It speaks from the mother's eyes.
And this feels like a moment of speaking out these truths that comes from this perspective of being in medicine and motherhood.
Right.
That's always been there in the last couple of decades of our lives. And we've both been kind of traveling in parallel channels almost.
Yeah.
Through our interests or
Were they parallel or right there, but we just never intersected?
There you
Right?
go.
I mean,
right?
we were side by side and unintersected. Parallel also. But somehow I feel like I was there with your story.
There's some
Parts of
overlap.
it. Yeah.
Right? There's some overlaps
Yeah.
there. Yeah, the weaving.
The weaving.
Maybe it's that we were weaving through each other's stories, but we never really recognized.
Yeah, the space between the weaves.
Mhm,
Yeah. Oh my
mhm.
gosh, that's so true.
Yeah.
So, yeah, who are you?
Who am I?
Yeah, who are you?
I'm now a podcaster. We're both now podcasters.
Yeah, we just started.
We just started. And
You have just begun.
and I'm curious. I think you were talking about how curiosity has been a real central part of what you have brought into your everyday.
Yeah.
And I think to be a mother and to be a physician and now to get into and have gone into storytelling and to recognize that there's more to the medical enterprise than just what we've been taught
Yeah.
has been a real big part of what drives us, right? Like we've
Right.
been inside the medical industry and we've seen what's missing And we've seen it's good, but we've also seen its opportunities.
Yeah.
And that
Missed
opportunities. Right.
opportunities. Missed opportunities, right? Which now looking back feels like an opening, a place of discovery, a place of, reflection,
Yeah, making meaning.
understanding,
Yeah,
moving it forward, let's move the story forward.
I love that.
Yeah.
I love that because there's this kind of almost an inertia that's happening in healthcare where we've kind of lost our way
Yeah.
in medicine.
We
We've
swirled
lost,
around.
right?
You're swirling, so I'm going with the swirl.
Yeah, we've been swirling around. We've kind of lost our way. We're like,
Yeah.
medicine is this thing and medicine is that thing. And as healers, who started out being out of the box, because if you're a woman and you're in medicine, you're already out of the box.
And you're an immigrant and a brown person and a person of, I guess, color these days, but a person from a mixed background culturally and this displaced people, I would say, displaced from one country to another, to one system, to one nationality and language, and displaced and placed again, and landing in the universe of America and the opportunities of America, and grown up with seeking knowledge. Knowledge was something that was truly the thread that kept all of that connected. All those displacements, all that understanding was like, oh, let me learn about this too. This is cool. That's different. Wow, why is that different? And why am I different? What the heck is going on here? So curiosity comes from a place which I never even asked myself, why am I so curious? When is this curiosity going to stop? I mean, I've changed, gone to medical school, engineering, and traveled and learned and taught and researched. But I'm just like, am I done with curiosity? Because I can't get to the end of curiosity.
Are you done with curiosity until curiosity is done with you?
Yeah, yeah,
Like,
yeah.
is curiosity ever done with us? And yeah, like describing the journey of learning as how we engage with all the different parts of our lives, the challenging parts, the wonderful parts, the parts that don't really fit,
Right.
and still making them fit in some way that makes sense to us. So part of what we've also done is not just learn, but also tell the story of what's emerging.
Yeah.
And I think we've shared this narrative medicine interest.
Interest.
Crazy.
It's more than an interest.
What would you call it? What would you call it?
It is medicine. Yeah.
Storytelling
Is medicine.
Can I tell you a story?
Yes. So before we start though,
Yeah.
I want the audience to know that we are physicians. We are not giving medical advice, so do not use this as medical advice. This is your disclaimer. And we want to be able to talk about healing without being prescriptive, and also recognizing that every person is unique, and whoever's listening, if you get elements of this for yourself and using this as a healing tool or therapy or whatever you want, but recognizing, of course, this is not an official diagnosis of any kind. This is, because every person is different and your story may be different, but there is that perspective that can be given to talking about cases, medical cases, that is, clinical cases, as we talk about teaching and sharing stories in medicine for the purposes of engaging with what it feels like, or what that illness, what does it mean? What does it mean to have mental health, a mental health condition, chronic medical condition, right? What does that mean? What does pain mean? All these things that we have a diagnosis label for, breaking that open for psychedelics. But we do not want anyone to take this advice as medical advice.
Yeah.
But what can be learned with this curious
lens.
Okay,
Okay.
like that.
Okay, that's my side. Now, what's your side of that?
It's my side of that. Absolutely. The lived experience of people with illness is a very different experience, and we don't talk about it very much from that perspective of let's grow this outside of what it's traditionally been like.
Yeah.
And that's
Give
the
me an
place.
example.
Yeah. So
Give me
some
a
of
case.
the give you a case. I think what I will give you is the story of narrative medicine and how it kind of shifted. So I was doing this narrative medicine work, doing workshops, taking students to go see art. A good friend of mine, Ted Meyer, who's an artist and a patient, was showing art to medical students and talking about the lived experience of illness, right? And I was
Repeat that,
finding
the lived experience of illness.
yeah, and how we can demonstrate that, how we can share that, because that's an experience that's hard to share. And yet if we don't share it, it creates a kind of isolation
Yeah,
and a condition for where, oh, you have this illness, now you are this person. It's a labeling effect.
yeah.
Versus
You get
if you-
defined by
yeah,
that illness,
you
right?
define. And so how can we break out of it going, no, this is still a human experience I'm having,
Yeah,
whether it's called this or that. And how can I invite other people into my human experience?
invite.
Invite.
That's it.
Mhm.
That's a word. Invite.
Yeah.
So narrative medicine is the art of inviting people into your illness in a creative, healing way. Wow, I think we just got the name down, because I'm telling you, every time I talk about narrative medicine, you know the question that's coming next. Oh, I said, I'm passionate about narrative medicine. I really am. I love that concept only because it made sense when I was curious about what is narrative medicine. But the question I often get is, what is narrative medicine? Can you define that? Can you define it? I mean, we just defined
Yeah.
a possibility
Yeah.
of what narrative medicine can do and feel like.
Yeah, there's like the definitions and then there's the lived experience. So I think both of us came to it from a place of we are swimming in stories. We've both been pediatric hospitalists. We've worked with really high stress in really high stress
Yeah.
environments with families going through the worst day of their life, right?
ICUs and children, I would say, in one perspective, the child and the illness, and why does a child have the illness? But what the illness does, or what we consider illness, is really sometimes not illness. So it's just life, but it's also the beauty of that expression of what happens in the context of that illness too. I mean, it's not all bad, right? I mean, it doesn't have to be.
So we're kind of breaking the norms a little bit. So I
Yeah.
think what you and I probably reach for narrative medicine as a tool to step out of the medical interaction and look at it from a different lens. Like
Yeah.
what happens when I take this interaction that just happened
Yeah,
and I put the lens of somebody reading a novel, right?
right.
That's where not narrative medicine comes
Oh,
from,
yeah.
right? Is
Story.
when Rita Sharon, who has a PhD in English
And MD.
literature and MD,
Yeah,
but also has a PhD in literary criticism,
yeah.
took the text.
Columbia University.
There you go. Woohoo. And coined the term narrative medicine. So going back to the mother of narrative medicine, I think she was looking at it like, oh, this is curious. We don't have a way of talking about the healthcare interaction in ways that go beyond the labeling, beyond the interaction itself. How can we take it and study it and look at it and go, what else is in there as a human experience
Mhm.
of exchange and meaning making that's
Mhm.
happening as we're in the room, right?
Mhm.
Sometimes we'll be in the room and something will change on a dime and the mood will shift, or you'll
Yeah.
read something about the text of people's body language or
Right.
where they're placed in the room that'll give you an insight.
Yeah,
And there's no way
it's
to
the words
Yeah,
too that
it's
they
the
use, the
words.
cues that they. One patient told me that they know now how they were feeling. That they don't feel now as they become aware of their emotions, their feelings and sensations, they don't feel like they're fraying from the edges. Fraying from the edges, I said, as he disclosed this beautiful term, a man who is stoic does not speak a single word, but speaks when coerced in conversation in the medical visit to one word as they presented. But as they evolved in their treatment and their healing, their language, the expression of a feeling of what mental health, what depression feels like with those simple words, right? On the edges. And I said, wow, that is profound. You have said something profound that I need to write down. Because now I understand some part of what that means like for you.
And when that person feels heard,
Yeah.
that metaphor, right? Frame from the edges,
Frame
that
from the
image
edges.
that he drew for you. It connected you both in a moment of me where he felt a bidirectional understanding. Going, oh, she gets it.
Yeah.
In the quickest way that I could convey the
Yeah.
feeling of feeling depressed. And if somebody can get that
Mhm.
lived experience,
Lived experience.
like I walk around and I feel frayed.
Momentary
Yeah.
experience.
Right, live momentary experience. And so I think what we found ourselves doing when we were in clinical medicine was trying to understand this other layer that exists. And now that we've stepped into psychedelics, we're finding
No,
that
wait,
it's
wait,
all
before
here.
you get to
Oh,
psychedelics, I'll tell you what drew me to medicine
Let's do
in
that.
general. In general, medicine was an unknown desire. Did not want to be a doctor. No. I was like, no, not gonna be for me. But I wanted to be math and science. And I figured, well, I guess that's engineering because that's the only option between in the Desi family, right? You gotta be a lawyer, doctor, engineer,
3 choices.
and don't even think about being an artist or, going in that creative side of your space in your head. And I'm fascinated by math and science. I'm physics. I loved physics. My favorite class, my favorite teacher, Miss Lee, Clear Creek High School. Used to throw erasers at us if we weren't paying attention. That was the day. Gave us problems to solve that were just like fascinating. Like, oh my God, do we get to solve? Like, what does it feel like for a mosquito to land on them? What's momentum? Momentum is that mosquito that hits the windshield as you're driving. What's the momentum? Figure that out. It's going at this velocity, mass acceleration, this is the mass. And we were like real world, made sense. Like I remember learning about centripetal and centrifugal force and while making rotis, with my mom in the kitchen. And I was like, oh my God, Mama, I got it. I can make them round. I know exactly what I need to do. I need to put pressure on the periphery. And as I'm making the roti, and this is the key to making them round, I'm telling you, you make them round. You put the pressure on the edge of the roti and it moves and it rotates out and it becomes round. And I was fascinated by that. I was just fascinated. So my curiosity, is just, and I told you, I feel it I feel the light. I feel this, it just clicks, right? And then you're like, okay, I got this. Now I got to do this and I got to make this out. So engineering is where I went and I loved studying engineering. Don't get me wrong, I loved it. I loved studying.
We have an engineer in the,
I
in the
know.
room.
Engineering. Because it made
I love
sense.
that.
It made, process design and, circuitry and chemical reactions, and putting it together in math and then solving a problem felt very right. But it was very mechanical. I didn't know how to talk to people. I'll tell you, I was a nerd and I was shy. And I wanted to, I was working in a lab and doing, making glucose, infusion pumps, this is before insulin infusion, and was, able to really learn what that effect of that biocompatible thing would do in the body as an insulin. But I had no idea what the heck insulin was or why were we doing this. Anyways, I was interested in the mechanics. But then comes the time to do a PhD, I said, I want to do a PhD. I went to my mentor and he told me, no, don't do PhD, get an MD. And I said, MD? Oh no, why? Well, you do clinical research. And I said, oh, that's what you said. I'll do that. And I applied, got into medical school the day of bio, and I had to take a biology class, which I had no idea. But I took biology as a senior in college. And the first class, I was like, oh my God, the heart is a pump? You kidding me? Like it's a parallel pump and it's so efficient. Like, the engineers do not know this. They don't know this. They don't know the mitochondria line up nicely in the heart. And the efficiency of the mitochondria is because of the connections those mitochondria are making to each other and how regulated they are equals muscle contraction. So I was like, oh no, this cannot be. This is the body and it's a perfect machine. And then again, curious, and then came, oh my God, then I came bedside manner, which I was not so good at. Because I had to learn that art.
Yeah, me too. Me too. It didn't come naturally, but I was lucky in that I had two physician parents.
Yeah, the models.
The models. So my dad was a big storyteller.
Where were you?
Where was I? I went to medical school in Pakistan.
Yeah.
At Alpine University.
AKU for you
AKU.
guys who are AKU grads.
No.
It's a connection.
It's a
that you have.
connection.
It's a beautiful.
Yeah.
AKU.
Absolutely.
In Karachi,
92 to 97. And formative years of my life, very young life, and discovering, I learned about medicine from the time I could remember, because in our household, we were constantly, my parents would always talk about this patient's labs and what happened here and this procedure and what this diagnosis was and everything. So it was like I was brought up in the chatter of medicine. Yeah,
The dinner
and the
table.
language, dinner table
All day long?
language, all day long, everything. That was it. And so I was kind of bored of it too. So but I think I was a storyteller because I was always reading. I was always in imaginative world.
Yeah.
And to me, the language of medicine was fascinating because I recognized very early, I think, subconsciously,
Yeah.
that how you speak about something gives it away. Right?
Yeah.
Right?
Yeah,
Like
yeah.
what narrative medicine turns into. Because my dad, later on in life, when I was starting to do all these narrative medicine projects, this is the story I was getting at. He was coming out of anesthesia once and his barriers were down. So he was able to kind of communicate.
barriers were
His
down.
barriers were down, so he was looser,
Which
which didn't usually happen,
yeah.
right? Which didn't usually
Yeah.
happen. And he let slip that he had been following my work with narrative medicine, the writing I was doing. He was trying to understand it.
Oh my.
And it was coming full circle. So this is my dad on Ativan, coming out, driving home after his cataract surgery.
Himself?
Telling me, just being himself. And he
He
was
drove
like,
home?
no, I was driving
Okay.
home.
Okay.
And
Correction.
he was there sitting next to me. He was totally loopy.
Yeah.
And he was like, I've been reading about this narrative medicine thing. And this is a guy who's been in medical practice for like 40 years at the time.
Yeah.
He lived, breathed medicine. Like he was the doctor's doctor. Like he loved to diagnose. He loved to do patient care all times of day and night. But he would get frustrated in the outpatient.
Right.
Because he would keep saying that, hey, I have the prescription for you. Why are you not listening to what I have to say?
Right.
And he would get frustrated when people didn't follow through. Because he was like, I have the answer. Like I've looked it all up and read all of this.
Yeah.
This is gonna help you. Like
Yeah.
if you want to treat your diabetes, do this. And he recognized at the end of his life that sometimes people came to him just because he was a safe space. And he recognized that sometimes you just let people talk
Yeah.
and they'll just tell you what the problem is.
They will. They do.
They do.
When given
When given
full allowance, I think, or not even allowance. It's like, it's sometimes just nice to just witness, as they unfold.
Yeah, witnessing, being witnessed,
Mhm.
and how big that is to meaning making humanity, right?
Yeah,
If something happens, but I didn't get to share it with anybody,
yeah,
it's like it didn't happen. But if I can share it with somebody,
Yeah.
especially in inner turmoil,
Yeah.
oh, I have diabetes. Now, does this mean I'm a diabetic person?
Yeah.
What does it mean for my life? And he realized as he just allowed people to have more time to talk, that he got to the core of their question a lot more efficiently than if he had just looked at it from the place of this is your diagnosis, this is the
pathophysiology.
right,
And we
get
get
stuck in that.
Yeah.
But he was revealing to me that he had been doing this almost, he hadn't recognized, or maybe he had grown towards this skill set over time in medical practice.
Yeah.
And then he recognized that what I was getting at matched what he was doing already.
Yeah.
And that it made sense from the human perspective.
But there wasn't a term for it.
There's no.
Exactly. And I think that's exactly how I see it. It's just the art of medicine. It's just the same thing we've been doing. It's old school medicine. It's sitting down, having a conversation, and saying tea, and the doctor being at bedside, listening, being present, witnessing, sometimes holding the hand, sometimes writing, writing down things that are important, that make more sense when you think about it. We spend some time reviewing the case history and putting it all together. The doctor is the person that can see maybe allow broader perspective and knowing the science. I mean, come on, the medical science, the science behind the medical science, and the history of that treatment approach, and having that knowledge and curiosity.
Yeah.
It has to be about curiosity, right? I mean, having curiosity to say, okay, I'm curious about your problem. Let me just be very present with it.
Yeah. And question.
And question and dissect and clear and hold.
Get to the truth of it.
Yeah.
Medicine is also a detective story, right?
Oh yeah.
We're constantly.
Agatha Christie. Such a fan.
Exactly.
Agatha Christie.
Poirot and Miss Maple.
I loved it. No, Miss Maple.
No, Marple.
Whatever. It was Hercule Poirot with his accent.
Yeah.
Which
So
I
it's
don't
a-
know how to say, and I could never speak French.
Oh,
No.
yeah.
Okay, go on.
So that's the thing. It's like we're getting at something. So back to the definition of narrative medicine. It's what doctors and patients have always done.
And
Maybe subconsciously, maybe in a long form
right,
when there was more time.
right.
And now that we've kind of chopped up time
Yeah,
into
yeah.
small pieces.
You have to do 15-minute visits and it's impossible. Impossible.
Yeah, that's
Do
like
a 15-minute visit, history and physical, and diagnosis, treatment, and put it in the chart and leave the room and say goodbye, see you later. It's just too robotic.
yeah, it's the difference between a novel or short story
Yeah,
and a tweet. And
yeah.
now we're at tweet world.
Yeah.
Where we're just saying you have 15 minutes to tell me.
1-minute stories.
Yeah,
Mhm.
and I think what we're doing with narrative medicine is recognizing that even in a short time, there are still skills you can apply to expand it out because we can play with time.
Yeah,
One of the wonderful things about narrative medicine to me that was just so operational in hospitals medicine was the idea of time,
yeah.
the chaos narrative,
Oh,
the
yeah.
restitution narrative, where, when somebody's in the hospital,
The quest.
the quest narrative, when somebody's in the hospital, they're in a chaos narrative. They have lost track of time. And so one of the things we recognized as I was teaching my students and everything going, when a patient says that you didn't spend enough time with them
Right.
in their room,
Yeah.
it's because for you, it felt like a good chunk of 15-20 minutes, in a very
Of
busy
your
day.
time.
Yeah,
Mhm.
in a very busy day where you've given, 20
Time
people
to
that
everybody.
exactly thing.
Yes.
And for them, it's a small
Sliver of the
portion,
day.
right? In a vast day that felt endless,
Yeah.
right?
But
So
you're
it's-
waiting.
And you're waiting. And so recognizing that when you walk in the room and you slow down to their time,
Line.
right? By sitting down,
Yeah.
by just aligning,
Right.
taking a breath And arriving.
Yeah, it's called a set and setting in psychedelic
Yeah.
medicine, man. That's
Yeah.
just the term, man. That's
That's
the, bro, that's
Yeah,
the
bro.
thing these days. So,
And I just
sis,
took, yes,
sis.
sis, and I just took a breath and I feel like I just settled. So I'm gonna settle a little
Settled.
bit more now. And recognizing that, yeah, we are dealing with how to play with time nowadays. And how can we make the most out of that 15 minutes? And so I think that's what this podcast is about, is the medical, the interaction, the narrative lens,
Narrative lens, the psychedelic mind,
and then the psychedelics.
and the integrative medicine. Don't forget.
The science of
Connect,
it.
integration machine, the science, the art,
Yeah.
the spiritual, the heart, the body, the liver, the kidney, the thought, the desire, the sadness. It's all connected. Healing is it's not just about hypertension anymore, right?
No, it's not just the body.
It's about what the heart feels like. I don't need to be in
Right.
stress mode.
What's it carrying that's
Yeah.
creating the hypertension,
Yeah,
to which the blood vessels are remodeling
right.
and the cortisol is pumping, and over time what that does to a body.
Yeah, so we're gonna have cases, I'm telling you, and we're talking about this kind of healing. We want to be able to demonstrate or even review or even support, or even if you have questions. I think curiosity, let's keep that light bulb on. Let's keep that going. I mean, kids are curious and they stay curious as long as they're allowed to stay curious. Stay curious with curiosity. We want to discuss cases, medical, spiritual, put it all together, help. Psychedelics is an opportunity, right? It's a tool. Narrative medicine is a tool to the definitions of, and science is a tool. Spiritual practice is a tool, right? Put it all
Absolutely.
together.
Yeah.
Stay curious.
It's like that big elephant that's
Yeah.
in a dark
Oh,
room, right?
that
And
is
we're
a-
all
That comes from, tell me about, about that.
where that comes
Yeah,
from.
of course, the elephant in the room. What is that? This comes from a story. And you're gonna tell me about that story.
I don't think I
Yeah,
remember
oh,
what's the.
roomies.
You tell me then.
Okay, so it is a room of now, don't get me, it might be about 7 or 5 blind. I don't know, have to be men.
Mm.
Men, they're not blind actually. They're in a room, in a dark room. The lights are turned off. And each man is positioned on a side or part of the elephant. And it's dark. And they're asked by somebody, I don't know who. Maybe this is the story, but maybe my interpretation
It's a
is
great story.
they are asked to interpret what is it that they touch and what are they touching, and to imagine and to, and to disclose or express what they feel they touching. Whatever part of- extrapolate from whatever they're touching. So one man standing by the trunk or the tree or I just gave it away. The foot of the leg of the elephant feels the tree and says, "Oh, this is a tree. Of course, it's a tree. It feels like a tree. Come on." And comes the flap of the ear, and the person says, "Oh, this feels like bird's wing," something like that. And so each person, the tale is interpreted, and they know what an elephant looks like. They've seen elephants many times, and yet when the lights turn on, they're told, you saw something else of the same thing. And you didn't see the elephant in the room. Right. You thought it was something totally different.
I love that definition of the elephant in the room.
So it's like the most obvious thing, right?
Right.
Which is the American or
Interpretation of that.
interpretation of that story. But the elephant in the room goes beyond that. It's also about philosophically, what do we see from what we are exposed to, right? Our world, our perception is exposed by what we interpret of that world.
The priors.
The history.
The interpretation. So all of these layers that we're bringing in are our ways of interpreting, but remaining curious allows us to remain open to the fact that we may not be 100% right,
Yeah,
and that that's okay,
yeah,
because knowledge is always growing.
yeah.
It's co-created.
Yeah.
I love this one way that we would.
And you can ask questions to what you're seeing and say, oh, maybe this is a dream, maybe it's this, oh, it could be this. But you don't stop it, but
Right,
go on.
premature closure.
Premature.
And I think that was one of the things that, I think as a medical educator, it brought me into the intersection of art and medicine, was how do we get people in teams, for
Yeah.
example, standing around the same patient,
Right.
doing that interpretive dance
That
of the elephant in the room. And they're all feeling a different part, because the
Yeah.
medical student is looking at it differently from the
Yes.
residents, the attending who's seen 1,000 of those cases.
Yes.
And they all have their interpretations, but how do we get everybody to
And the
hear?
patient.
And the patient has their
Yeah.
interpretation, and how do we get everybody to hear
And the
everybody's thoughts?
Yeah.
right? Of everybody who's in the room, right,
Mhm.
and the lived experience, and how do we get them to talk to each other, but also hold space for something, a viewpoint that may not align with their own viewpoint, right? Because I think that's also the layer that happens in medicine, where if somebody's perspective is different from ours, we
Yeah.
don't really know how to handle it.
And,
And, right, we get challenged.
we think we know pain
Yeah.
when we don't know anything about pain.
Right.
Really. I mean, unless you have it,
Yeah.
we think we know, oh, I can treat your pain, no problem,
And we think it's this one
Yeah.
thing.
Oh, yeah. It's gone? What's it out of 10? Which I
Right.
hate that question. Out of 10? Tell me what that pain scale is.
As
for
if
you,
we're all
the
right.
vital sign,
Right.
Yeah.
And how we've reduced it. So the
Yeah.
reductionism of scales, and
Yeah.
how it misses the big picture, and how
Yeah.
narrative and storytelling and meaning making and perspective taking, all of these narrative methods and skills are so critical to us understanding the full spectrum experience, the lived experience. So going back to, oh, how can we remain open as we're going through medical training with it, which is seeking to be more reductive,
Right.
and seeking to reduce somebody to their diagnosis. And when we get stuck in that model, what happens?
No, stuck.
Hmm,
Stuck is a
Stuck.
good place.
Stuck is a good place.
When you get stuck, you are in a good place. Just remember that. You are in a place of curiosity. That
Yeah,
is where curiosity is,
I love that.
in that stuck space. Be curious to your stuck space, because there's a reason. So that stuckness is happening. So what is happening in that stuck space? Are we stuck in a place of, okay, I'm here now, what do I do with this place? Or is it, why am I here anyways?
Right, what's the
What brought
reaction?
me here? I'm
Right.
stuck in this place.
Yeah,
You know,
how did I get here?
Okay, so how can we get out of this stuck? Sit curious about that, or a stuck question. It's important when you're stuck on a question. Like, but there's another question.
You're getting to the spiritual part of it, which is that when somebody finds a gap between who they are,
Yeah,
and who their true self is,
right.
and the life they're living,
Yeah,
I think that's that stuck place, right, of disconnect.
yes. So we're gonna call this the stuck cases. If you're stuck on a case, please present your case. We will have cases of stuck cases,
Yeah.
places of where cases stick, right? They get stuck. And then you come curious to that place.
I mean, in psychedelics, a lot of our patients approach psychedelics because one of the kind of storylines that have come out of the psychedelic experiences, it helps you get unstuck,
Yeah,
right?
Yeah.
It helps you move through the stuff,
move through. I've heard that.
right? And
What other
even
terms?
recognize,
Tell me more terms you've heard.
like, even recognize what you're stuck in. Right?
yes.
Like,
I
it
said
reveals to
in,
you in.
Because what are you in? What is your setting and your set state that you are in that is holding you or preventing you or imprisoning you, imprisoning you.
And
Trust me,
sometimes
my
I
English is not all the way 100%.
100%.
Okay, this is my language.
Urdu.
So we are brown dogs, gotta tell
Mm.
you, with a history.
Mhm.
Our story is also part of the narrative as well. Our narrative as humans, I think, and immigrants and people of color and edges of
Yeah.
edges in the norm, I think.
Yeah.
Misfits. Sorry.
I said this to
Misfit.
somebody the other day. I said, I think I've been a misfit everywhere
Oh
I've
my
been,
God, misfitted.
and now it's okay.
Yeah.
Now it's okay. Like,
It's actually misplaced. Well, you told me about
we'll
what
own it.
feels
We'll own
okay.
it. We'll own the place.
Own it.
We'll own the space.
Yeah.
Yeah, and I think even coming from the ancestral spaces that
Mm.
we carry, right? Like
And seen and
ancestral-
witnessed in
Yeah.
others, global health,
Mhm.
both global health providers, medical
Yeah.
doctors served in many different colors of life and
Mhm.
different, countries and languages. And again, the story is universal, I'll tell you, right?
Yeah.
The stories are universally known.
Mhm.
It's a different story each time.
But there's threats that are very
There's
common.
yeah, and
Mhm.
it's interesting to see that. Of course, we also will talk about research. We want to talk about research. We want to talk about cutting edge. We want to talk about, hey, opening this up into, throw this idea away. Open it up a little more.
Mhm.
Come on,
Yeah.
you can do this.
Absolutely, absolutely. I think that's what we are, that's the motivating force here.
Yeah.
Is that there are some places that medicine as a profession,
Yeah,
research as an endeavor has gotten stuck,
yeah,
right? And to
Or-
bring it back to that stuck place is like, where have we gotten stuck? And I think one of the frustrations we have sometimes is that the research gets stuck at a really low level
right.
and doesn't focus on outcomes, for example, in psychedelic
In psychedelics.
research, for example, beyond just proving the utility of
Yeah.
how the molecule is
Yes.
working.
Yes. What do we
Instead of-
do with that?
Yes.
Yes.
Instead of
Beyond that, right?
what did it really do to this patient
Yeah.
and their life and the transformation? And yes, you'll read news reports, but the news reports really just skim over some of the real highs and lows of healing
Yeah.
that we get to hold our patients through. And I think that's the part that we're learning the most from
Mhm.
as physicians.
Yeah.
Because even after 25 years in medicine, stepping into psychedelic medicine has not just brought up all of our clinical skills from a different angle, where we're doing the art of it and the science of it and the humanistic relational part of it,
Yeah.
but also the ethical side of it, which is how do you hold this medicine with this ethical stance,
Yeah.
the psycho-spiritual part of it.
Right. And we can, really, for the audience that want to know these things or curious too, our goal in this podcast is to support, educate, case work, I would say, patients who are seen as and treated as individuals, their story, bringing the elements of their story in the context of care. I love that. In the context of who they are. There's, their set and setting, psychedelics as an aspect of that story. And but what are we really treating? Or what are we really treating? Asking those questions, each person as they bring these stuck stories, or as we talk about stuck stories, what are we really treating?
Absolutely. And here's the moment where we jump off into, well, we can't, when you talk about the context of the person, you got to think of where they live, the history of injustice, maybe, where in the societal fabric of structural injustice do they, did they find themselves, the intersectionality of their identities, their lived experience of health and well-being, or illness, how they were treated within the healthcare system, their history of maybe incarceration.
And in case this sounds overwhelming, there are tools to address these things. There are ways, and that's what narrative medicine provides, is that tool kit that helps kind of methodologies, the application, the 5-minute visit, really that can be real 5 minutes of knowing connection.
Yeah, and how can physicians develop this capacity
Yeah.
and a skill set to know that no matter where they go, with enough of this kind of perspective, they can really show up for their patients in ways that may not have been available to them before, or just open up the caring framework to allow in what the patient is already, subtextually, subconsciously asking for, but we haven't been able to detect.
Yeah.
Is this patient here because they really just like talking to you?
Yeah.
And
they're
you're
just depressed,
right?
lonely.
Yeah, and they want to, and you're the only person that's
They don't want
kind
you
of.
to write, pull out the prescription pad. Yeah.
And
Or the
what would it be
computer.
like to say, okay, this person is here because we really get along, there's this part of this aspect that they want to talk to me about
Yeah.
of their life, and they find some meaning in coming and sharing that, and even in just that conversation, because conversations are also living things, right? Like you don't know sometimes if where the conversation is going to end
Yeah.
based on where you
With
began from.
this is where the discomfort comes in as a physician, right? And this is the next episode.
We'll talk about the
Yeah,
discomfort.
the
So maybe,
discomfort.
we go to
Yeah.
discomfort. I love that.
Yeah, when we're operating from a place of discomfort or uncertainty as a physician, right? Because there's a place of doubt and uncertainty, and that you have to be able to be confident in, like you don't know everything, and you shouldn't know everything because you want to know more about, from what you learn, because you're constantly learning. But I think, let's talk about that in the next episode. This episode.
Yeah, I think we talked about who we are, what brings us to this word, curious place, what narrative medicine can do.
Yeah, we are Too Curious MDs.
Too Curious MDs.
Narrative medicine and healing. We are Too Curious MDs. Narrative medicine and healing. We talked about what we do. We also talked about, I want to talk a little bit about the naming of Too Curious MDs.
Which we just did today.
Yeah.
So we're both of us, but we're too curious,
Too
curious. There's a little aspect
and curious.
Right? But there's been, and also just thinking about being, thinking about the two of us, in our lives having been sometimes too curious, been said you're too curious, right?
Yeah.
That's a negative.
Quiet.
Yeah. Don't be too curious.
No, you don't want to be too curious now.
Curiosity.
You want to be careful with that, Yeah.
Yeah.
You've been told that, and you've been like, I want to be curious, but curious, I can be quiet. Curious, I can go in the background and check it out.
Yeah. And that's a childlike quality.
Yeah.
And as pediatricians, I think we both agree that, curiosity is the kind of job of childhood. Playfulness.
Yeah.
And losing ourselves in that. And I think that's the other place that we
connect.
Connect that it's an important aspect of the human experience that I think over time if we lose touch with that curiosity, or when we lose touch with that curiosity, we lose something. We lose, right?
Yeah, that is where sadness lives for me. If I lose my curiosity, I know that will be a sad place for me, and has been. Yeah, I just saw it in my head. That sad part of my life, which was not curious.
Right. When we're stressed. So one of the things that we recognize, I think, as practitioners in psychedelics, your body's trying to talk to you.
Yeah.
You know, you're always, right? Like your body is sending you signals. Something's not
Machine
right.
that's totally cool.
It'll do its job
It's
if
got
you feed
sensors,
it.
like, you know. And it's oh my God, don't get me started on pathophysiology, because and the bringing of pathophysiology with the simplicity and spirituality, but it makes sense. It's so simple. It makes sense that it's so simple. It's not, I mean, you know, just the heartbeat in parallel, two parallel pumps that synchronize to each other.
Yeah, in a vortex.
Bum, 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 bum. You know, that and the spread and the relax and the attention and the relax and attention. I mean, we heartbeats every single day from the first cell of the heart made. And then from that one single cell to multicellular to this to organ system, it's been beating, unknowing to our conscious mind, you know,
Just staying open
Yeah.
to that wonder
that
'Cause-
wonder.
yeah.
How does it do that? How?
and the synchronicity and what nature has to teach us
Yeah,
about how to live in balance. You
Yeah.
know, the heartbeat, like you're saying, there's contraction and relaxation, contraction and relaxation. And that is such a lesson, right?
yeah.
Of seasons. And yeah, there's times when you're really active.
And the body responds.
And there's
Yeah.
times that you're really relaxed.
And the body responds.
And you want to be in both, you want to
Yeah.
flow through both.
Yeah.
And if we're not flowing through both in a way that is, you know, in balance,
Yeah,
then we get stuck in a place. So we get
Mhm.
stuck in
a certain
one
rhythm,
mode, right? And then,
certain
yeah,
process, certain channel.
yeah, and then that is indicative of the pathology that's happening.
Yes,
Right.
so there you go.
Mhm.
Stop right
Mhm.
there.
Mhm.
Indicative of that pathology. Indicative. When you get in that stuck place, it's indicative of that stuck pathology. Yeah, but what happens, right? In that place of pain. However, don't forget, the body is regenerating, right? There comes, you know, when you're regenerating, your one part of you is a little messed up, okay, got a little defective, you know, memory and trauma memory, and it's just kind of just out of sync. But there's the other part, hello, you know, I mean, I don't know why we treat hypothyroid the way we do. I find that amusing now, because I'm like, you guys are gonna wait till the thyroid totally becomes dysfunctional, and then you'll start paying attention to it. Before that, you're not gonna do anything.
Yeah.
Like, it's already showing you little signs of some stuff, and you didn't even ask those questions. And I just sit there and I go, patient, you know, the patient is having those symptoms, and in their story, they did disclose a few of that. So why wait? Let's heal the well. Heal the well, and the bad is not gonna be as defective, right? Or whatever.
Yeah. So you're talking about how sometimes if we're using only the science lens, we can shut down the story.
Yeah.
And because it doesn't fit into an already prescribed box, we may feel like there's nothing to be done here.
Yeah.
Or we can misinterpret, or
Because we're
Not
looking
really
not at the
hearing.
box, we're looking at symptoms. We're
Yeah.
looking at the problem the box is making, you know, it's
Yeah.
making the regular heartbeat sound, you know?
yeah. And so because we get to premature closure
Yeah.
about something, we don't remain curious about like, well, what's really happening
Inside.
and what we could do.
Yeah,
what we could
yeah.
do. And so going back to the heart and the relaxation
Yeah.
and the contraction and that flow that we become.
The vagus nerve.
Yes, there you go, the
My
vagus
favorite
nerve,
nerve.
right? So we as practitioners of the body, we recognize that, oh, there's ways, and I think, you know, science is backing this up immensely right now. There's ways that we can control the internal balance of our body.
Yeah.
Then there's something called inner healing intelligence.
inner healers.
So maybe we talk about that. It's
I
like,
know.
how do we put the science and the art together with this idea that there's an inner healer, that there's a part of us that, yeah, you cut your skin, it'll clot by itself.
It's like amazing. I just cannot get over that.
There's little fibrin layers, there's a little
It comes with all the
clot
yeah. It's
forming.
like it's got an army and we are talking to each other. The receptors are online. It's just hit signaling. Send those platelets right over. We need them, buddy. Can you rush it over?
How are they communicating? What's happening?
They punch it up and they do patch work and they do it in seconds. Yeah.
So there's an ability of the inner healer that we see in these in the material world.
Yeah.
But then we also talk about how there's an inner healer within all of us in the psycho-spiritual world when we go deep.
Now, how deep
Yeah.
do you want to go into that realm? Spirituality? Are you kidding me? There is spirituality in medicine. There is.
There needs to be, right?
I
We've
know.
put it in a box of only
Outside
talk
of the
about
medical.
it. Yeah.
Yeah.
But we put it in a box where, oh, it's the chaplain.
Yes, the
Right.
quietest place in the whole hospital.
There's a
And
chapel.
nobody goes to.
Right.
Some do, but
And so that's so it's
Yeah.
symbolic, right? Is that
Yeah.
the chapel is in one corner of the hospital in the basement somewhere, and if you're looking for a quiet place, you can go there. But isn't there spirituality in every single patient room?
there is. This is what I appreciated when I was working overseas. I really appreciated this part of walking into the patient room, was to hear and see things people were doing. This is where Eastern and Western medicine dissect.
Mm.
One is, hey, this is the monitor, look at the monitor, the heart rate, and
Mm.
and I'm oversimplifying, please don't get me wrong. I think there is a wellness component to, many Western systems that is coming, but the Eastern cultures, sorry, they beach Western culture that is possible place, they really do. I think because we grew up with that. I know I did. I grew up with, oh, beta, put some haldi on this and haldi turmeric, and just rub it here, and I'll sing you a song, and this is the meaning of the song in our language, in our culture, and there was a ritual. There was, a blessing. Blessing. We blessed. We blessed. We blessed the water. We used to pray. I'm Muslim, so I believe in the blessing of the water, and that water is entering you, and it's sacred. But we had that in my repertoire memory bank. And now getting to see, oh my God, that is important. Hello. So I had that appreciation. You had it. You were in Pakistan and
definitely.
in the Middle East, and
So when when we're looking at this psycho-spiritual space from the perspective of healing, many different cultures have articulated a lot of different rituals, different technology.
yeah,
You can call it technology.
Yeah.
It's like, oh, there's words, there's voice, there's touch,
yes,
there's a ritual
Incense.
space, there's
Mhm.
incense, there's
Mhm.
smell, the sound, right?
Yeah.
Of prayer, of
Yes.
many voices
Rhythmic.
together,
entrainment,
right? Entrainment. We can talk about how sound is healing.
sound is healing.
So we're all
Yeah.
going back to the place beyond the separation to a place of, I think, universal understanding that all human beings respond to some level of this technology, right? You hear the
Yeah.
call to prayer 5 times a day in a Muslim country,
Yeah,
and there's some sort of kind of entrainment happening of,
Yes.
oh, in your busy day, there's still,
meditation,
there's still a call to your spiritual self,
right?
and you don't have to do it if you don't want to, if you're too busy, but there is a space for it, and it
Mhm.
has to do with the time of day,
Yes,
right? So this
time of day.
idea that the 5 times that you pray in the day have to do with, oh, before dawn, that's a sacred place.
Why?
Yes.
Can you tell me now? Why?
And tell you why that would be.
Okay, We're
Tell
naming
me.
the five. No,
Oh, right. So
I'm just curious,
Fajr,
yeah.
Zohar,
Uh-huh.
Asr, Maghrib, Isha.
Yes.
So that's the five Isha in Arabic.
Yes, in Arabic.
And the first one's before dawn.
Before dawn,
Um,
before the break of light.
yes, before the
So
break of
you
light.
are no light has entered into the
Ah.
atmosphere before the first break of light. It's in the
Mhm.
scripture
Yeah.
before the first break, right before actually.
Yeah.
Right before the first break. Okay, now.
And then what happens when you, as a human being, on this planet, in looking at the dark sky towards the east, for example,
Yes.
look up and you see the sun come up, just a
east,
little bit, right, from the east.
right before, right?
Yeah.
It
So
breaks. Yeah.
So there's this interesting
Time.
connection
time. Yeah.
to time being something that's embedded in the natural world
Yeah.
and in the cosmic.
And the cycle and the melatonin.
Right, that it connects with you. Like we are, right. So we are evolved
Right.
to wake up in the morning.
Right before dawn.
Yeah.
That's our evolutionary pattern, right?
Right.
Okay, then.
So if you can do that, that's a
Mhm.
spiritual space.
Definitely. a spiritual space,
Right, so
right?
you're
When you wake up
open.
and you go look at the sky as light comes through, right? After you go to prayer first.
Yeah.
Because you have to pray before, right? Before that.
Yeah.
Go on.
So it's Fajr, and then there's like the middle of the day.
Yeah.
So you're busy, it's before you eat, it gives you a nice break in the middle of your day around before noon.
Zohar, right?
That's us.
Zohar.
Zohar.
Zohar is at the
That's
peak.
right.
The
It's at the
sun is
peak.
at the top of the highest.
Right.
Right?
So that's a time of day where you're like, okay, I'm gonna stop in the middle of my busyness and I'm gonna just drop into a meditation.
Yes.
Right.
Mhm.
And then same thing at the end of the afternoon.
Asr,
Yeah. So
right,
mid-afternoon.
before. Go on. I don't know what's the significance of that time.
It's not always cosmic. I think that is, because Maghrib is right before
At
the
the
sun
last-
sets.
Yeah, this is
Right.
before the sun sets.
Yeah.
Because the sun sets below the horizon.
Right.
We actually see the image of the sun in the sunset. It's not the real
Right.
sun. So before the sunset. So somebody knew this, by the way, before science,
Right.
before we knew it.
We intuited it.
Mathematically.
We intuited it.
Knew that that was an important
Yeah.
time.
Yeah, so it's a
Before the sun-
technology.
yeah.
It's a technology, and then the last one is in the night,
At
right?
night.
And there's prayers for the middle of the night too, and there's
Yes.
prayers that, so just even recognizing that Eastern religions or philosophies are technology
Yes,
where our ancestors recognize that we are connected
right,
to something outside of ourselves.
right.
And you can go back to every civilization that has tried to make meaning of this experience.
Yes,
And no matter which way we go, we are connected, we are here, we are co-evolved, we're grounded, we are on this
we
planet.
are in reverence to
Yeah,
right, something bigger than ourselves.
right, right, which is a really, I think, grounding space to be in. And I think that's where people who are coming out of psychedelic experiences
Yeah,
go to and say, wow, I haven't felt that before.
yeah,
Or I wish other people could feel that because it's a sense of being connected.
yeah,
And so why is that healing
yeah.
when you have a mental health crisis?
Okay,
Why is that
question.
healing?
Okay, that's the next episode.
That's the
too. So why
curiosity.
is that healing? Like, come on.
Yeah.
That's a question. I find that, okay.
Why is that a healing space? Like,
Why
why
is
is
that
the
a healing
mystical
That's a great
experience
question.
healing?
That's a great question.
Right?
Why
Because all
is-
these studies are showing us that when you do a psilocybin journey
Yeah,
and you, the Johns Hopkins studies have all shown, Roland Griffiths, who just died last year, spent his
life
yeah, his
dedicated
career,
to this idea of healing. Go on.
yeah,
I know.
of recognizing that the mystical experience was important.
Yeah.
And then he created the mystical experience questionnaire from, I think, Walter Pankey's work. And the mystical experience questionnaire has been correlated to the durability of the impact on depression.
Yep.
So it's
And
like,
ketamine or any psychedelic
right,
correlates to explain correlation.
correlation. So if you take 100 patients and you give them ketamine experiences or psilocybin experiences and you look at, yeah, some people got better, some people didn't get better. And out of the ones that got better, how many had a durable, durability of that effect? Like how long did that last for? And what they're seeing is, if
But then you measure the mystical.
yeah, so you got a
Okay.
mystical experience questionnaire for all of them.
Okay,
And
break
so
down the mystical experience
questionnaire
for me.
okay, so
Yeah.
I do the four,
Third
we do the four,
13.
there's 13, but there's a
13.
4, there's an MEQ 4.
Oh,
That's
too short.
shorter, that's shorter.
Is it? I
Yeah,
didn't know
yeah, yeah.
that.
So you do, anytime during your journey,
Yes.
your psychedelic journey, did you feel that you were connected to something larger than
Yes.
yourself,
Mhm.
or understood that something sacred about this
Internal
experience?
unity, external unity.
Yeah.
You measure internal and external unity in terms of pointers, in
Right.
terms of a scale, right?
And even the
I
idea that it's
found that he came up with this questionnaire, by the way. Right.
right, and all this work started from the 50s and 60s when, Tim Leary and Ram Dass,
Yes.
all these different people were doing all of this psychedelic work. There was a lot of this research going on. They came up with these mystical experiences. They wrote these down, right?
Mhm.
They were actually literally sitting there doing these journeys and talking to each other afterwards, going, "What did you experience? What did you experience?
Yeah.
Oh, there's something about
And
this
that's ability,
feeling." Right.
quality.
Yeah, noetic quality that
knowing
something is.
Just
right?
knowing,
Mhm.
just that sense of knowing.
Yeah.
Which this is a very new term for me in medicine and in learning about it when the word noetic, I actually had to look it up.
Yeah, me too.
What is
Nobody knows
noetic
that, no one.
mean?
And ineffability, right? Which is
Ineffability.
that it's hard to even describe in words.
Yes.
And
Some
then
words.
what are we finding? That this is a universal experience that anybody can have.
Yes.
We have it in prayer, we have it when we're out
In
in
breath
nature, in breath work.
Yeah. In
Um,
connection, like spiritual connection.
Yeah.
Right?
community.
Connection. We are
Yes.
spiritually soul sisters, spiritually connected and
Yeah.
in a way that's hard to describe. And yeah.
So what about this experience is healing? Is the question that I think they're trying to get at through this mystical experience questionnaire. And so as we look at the research now and we look at all the randomized placebo-controlled trials being done, and they're trying to blind the medication. So participants who received the medication or didn't receive the medication didn't receive the psychedelic wouldn't be able to tell the difference between the two. However, how do you blind somebody to this? There's nothing else in the world that creates this experience. You know that you
Mystical
are,
experiences. Yeah.
you know when you're having the psychedelic. So I think that is one of the things we're learning as we're, embarking on our journeys as scientists and educators and physicians in this field is, yes, we have this framework of research that's built around pharmaceutical discovery. However, does that framework of research work here? How is it not working? And what are the real harms that are happening from us not being able to really translate the research, translate these clinical experiences that we're seeing our patients having into
Okay. I'm gonna
research.
play devil's advocate here. I'm gonna pause because I think when I'm thinking about the audience at this point, and that's you guys out there,
Mhm.
because I know here comes questions,
Mm.
and it's a good place. Because we feel like we have known this and get this in the work that we're doing right
Mm.
now. But for the audience, they don't know what the heck we're talking about.
Mm.
And maybe they do, maybe they're curious to that, but what does it really mean? Like, come on, I mean, how does spirituality really heal?
Mm.
I'm playing devil's advocate. I have my doubts, doctor, because
Mm.
I think I've been told this, I have this disease, call it fatty liver. I mean, come on, how is spirituality gonna fix that?
Good question. Good
Yeah,
question.
fatty liver and,
And
spirituality.
Yeah.
It's not gonna heal that.
And also understanding that people come to the word spirituality from many different angles. And understanding that some people have also been burned by spirituality or spiritual
Their trauma from
community,
spirituality.
right? And
Uh-huh.
so there's religious trauma when we talk about this. I've
Right.
had religious trauma, so
Yeah,
there's, I indefinitely full disclosure is that this is not the be all and end all
no,
framework. And that this is something that is for each person to understand
Yeah.
and create their own understanding of like, okay, what is this body? What is this lived experience? What is this consciousness? What's my true self? What is my purpose here?
Mhm.
Right? Like there are all of these questions that I think we circle around, and I love that, the adolescent, young adult is the space where we do all this work, right? Where we
Yeah,
kind of confront that idea of, who am I?
yeah,
What's my purpose? And more and more we're finding that that is a harder discussion to have because we get bogged down in some questions of like, right? Like most of us don't have language for our own spirituality or don't understand how our body and our lived experience of connectedness are
disengaging
yeah or
from each other and from ourselves.
right. Or how does that interplay work, right? Like, why is it that there are times when I am in a training cohort, for example, with others who are also learning about psychedelics and we're practicing what this what the relational aspect is, right? So we're kind of discussing maybe our own psychedelic journeys or talking about patient cases, just like we're going to do. And we recognize that there are parts of this experience that we can't put into words, right? But we feel it.
Feel it.
We feel it in our bodies. We know how it feels,
And
and
then-
that there's a well-being aspect there that we lost touch with.
Yeah,
You know?
so there's your stuck place.
Right?
And I'm just gonna call it now.
Yeah,
Because when you get to a stuck place, that's where you pause.
yeah,
And there comes creativity
yeah.
and thinking outside of the box. What else? Co-create, what else comes from this place?
Yeah, I think as physicians too, as we're delving into psychedelics, one of the things is, keeping somebody safe. So whenever I'm prepping somebody, I'm saying that, yes, this may change your worldview. Or doing this experience, going through this experience comes with the chance, the opportunity,
Yeah.
or the risk,
Yeah.
depending on who you are, how you look at it. That this may shift your worldview into a space which feels unfamiliar, that calls into question, or maybe even confirms, right? What you already always know, but couldn't articulate. So how do you make somebody ready for that? And also open
Well,
up
they have
that
to be ready.
invitation. Right, they have to be
some
ready,
degree.
right?
Some degree, informed consent comes in.
Right, so that's part of the informed consent, which
Yeah.
is unheard of in medical practice, right? In what other informed consent are we saying? Yeah, this is gonna change your life. Are you gonna be okay with some
that.
of the disruptions that may?
Chemotherapy to be for one
That's one of
example,
them. That's
right?
one of
Do
them.
you really get informed consent? Did you get informed consent for your
For what?
treatment of any kind? What kind of informed consent?
I mean, informed consent is a whole ball of wax that we can unpack.
Wax.
Yeah, we can unpack that of what is really informed consent. How can you be completely informed? And is it consent if, let's say, you're in an emergency situation, you're like, yeah, just do whatever it takes to fix me. I don't care.
Yeah,
I'll take the risk. Versus, how do you get into a space where this is completely voluntary, right? How do you do informed consent properly in an experience where you can't quite describe in words 100%, no matter what you do. You could read every book there is in psychedelics, but if you've not had the psychedelic experience, you don't know, because it's an experience, right? And it's a hard to describe experience, because it is an embodied, felt experience. It's also an experience that feels connected to everything there is. And so I can say these words, but how many times have we had
Okay.
patients coming out of a psychedelic journey who are like, oh, I did not understand what I was getting into.
I know.
Right?
That does happen.
That does
does
happen.
Thanks for joining us on the Too Curious MD podcast. We hope today's episode inspired you to ask new questions and explore fresh perspectives. We challenge you to ask us those unasked questions that you're curious about in your medical practice, condition, health, and wellness.
If you enjoyed the podcast, don't forget to subscribe, share it with somebody just as curious, and leave us a review. It helps us keep the curiosity alive. Post or comment with a question or curious inquiry that you have and seek to explore or learn with us. Stay curious, and we'll see you next time.